more boots on the ground. Canadian Rangers, already battling an unfolding crisis, now get more help from the military.
Busy.
COVID-19 infections have declined slightly in Kashechewan, but there are still about 200 people sick, the majority children who aren't eligible for vaccination yet.
Cases remain far too high.
The Alpha variant continues to circulate in the First Nation, and so this new deployment.
The armed forces will be in the community until at least the end of the month to help with everything from isolation sites to delivering food.
Until now, the community had no room to quarantine members and too few testing kits.
It's an epidemic, it's a travesty. The issue really is overcrowded housing. There's 20 people in a house.
It's very concerning. I mean, we haven't seen numbers like this ever in our region.
The First Nation leadership blames the severity of the outbreak on a slow response from the federal government.
When there's a crisis, especially in remote Northern Ontario, things can't happen fast enough.
We have done our utmost to be there for the community. We know it's fragile.
The Minister of Indigenous Services says he's following up to see if any mistakes were made.
There is a preventative approach to all these deployments. And when they are not sufficient, we have to rally quite quickly.
Nearly a dozen community members have already been flown out of Kashechewan for treatment. Health officials say the next week will prove critical in determining whether the new military support can help contain and end the outbreak. Olivia Stefanovic, CBC News, Ottawa.